Okay, so for this video, we're going to be talking about this kind of pivoting, shifting of weight with kind of a lateral rocking motion from the hips and the knees. There may be a little bit of a twist here. So also imagine like somebody skiing, like downhill skiing, as they shift and twist, through their body and adjust and adapt from the hips and the knees and the core and the torso and the ankles even, and just kind of feel where you can more dynamically adjust. This is good for balance. It's good for learning to stabilize through your body in different ways, in dynamic ways, especially if you have knee pain or have recently had a surgery, maybe not too recently, but have had a surgery, and maybe you're lacking some stability, some strength, some control and balance, and trying to learn to use your body well and effectively without overstressing, overstraining. So we're going to retread through some key concepts, some basic things, but progress into some more dynamic movement. So a good way to do this to start is to do this, more sitting, where you're not putting full weight in here, so you can kind of get a sense how this works. So we're going to think about kind of pistoning the hips, the knees. So to do that, I'm going to pull in my thighs. I'm going to align my legs so they're parallel and front facing, forward facing. And I'm going to pull back. I can use my hands to kind of guide that, but I want to get the sense that my chest is coming forward, my hips are back, and I can ground in my heels a little bit here, which you can't fully see there, but that's what I'm doing. And then from there, I want to be able to kind of maybe shift. So I can shift my weight from side to side here, and I can kind of start to rotate at the hips. So we have this idea of we can rotate from the trunk, rotate from the hips. We don't want it to be too much of one or the other. We want to have a nice balance here, but I can kind of lean, I can shift, but I want to stay tall. I don't want to like lean over and lose my balance. So I want to feel it can kind of drive through, shift, load, feel my weight as I ground back into the hip and down through the heel. Steady, stabilize, not stressing, straining the knees, because I'm driving back in the hips and driving my weight forward through my chest, which is ultimately more over my feet. So I'm over my feet, but I'm pulling back into the hips. And I'm almost imagine I'm starting to stand up. And then we can progress that into standing. So here, again, I'm pistoning and pulling in to align and pistoning back in those hips, and then I'm just kind of shifting here, and I can kind of do a little swivel, a little twist, but I'm trying to pull back in my hip so I'm not overloading the knee. And then I can imagine this kind of like, almost like two levers here, kind of back and forth as I kind of steady and stabilize through my ankles and try to adjust through there, forward, backward, side to side, twisting, turning. More if you have a weighted ball or something, you can bring that around, kind of pivot. But you want to maintain stability, maintain control with minimal pain, especially in the knees, and be steadiness. Most of your strength stability is coming from your hips, but you're also stabilizing through the feet, the ankles, those tripods in those feet. You want to make sure you're in control. And especially when you shift to one side, pull in that inner thigh and kick back so you're in your heel, and pull in your inner thigh so you can anchor the big toe knuckle down and not roll your ankle. You'll be really in control. So again, this is good for just general balance and control, transfers, shifting, weight shifting, and even on uneven surfaces, even though I'm not directly on it, I can simulate it with all these little weight shifts, how I need to recenter and rechannel my body and have balance and control throughout and not overstressing, overstraining knees or anything else.